So hi everyone, this is Dr. Munir again, and I mentioned in my last video that I'll be talking about and discussing about the chronic fatigue syndrome treatment in this video. So here I am, as I promised. So first of all, again, for my viewers, it's basically important to understand what it is. Chronic fatigue syndrome is basically a syndrome which affects so many people, and it's basically a person feels persistently tired despite having adequate nutrition and being perfectly all right. So let's start with the treatment first. As I promised before, recent studies have highlighted that chronic fatigue syndrome, it may involve immune system dysregulation, mitochondrial dysfunction, and neuroinflammation. So notably, as I mentioned in my previous video, the DECODE-ME study, it identified 8 genetic regions that were associated with chronic fatigue syndrome, suggesting that it's a biological condition and it is not just a made-up situation for, as you know, we see a lot of people complaining regarding that. So let's talk about the symptom management. While there's no cure for chronic fatigue syndrome, as I mentioned, but the treatment focuses on symptom relief. So according to UpToDate and other physician portals that we use as physicians to treat our patient, it recommends a personalized approach and an individualized approach for every patient. So first we start with a cognitive behavioral therapy. What is it? It can actually help patients manage the psychological impact of chronic fatigue syndrome, and it can actually improve the coping strategies and quality of life. Number 2 is the graded exercise program. It involves individually increasing physical activity levels. However, the effectiveness varies and it should be tailored according to the individual tolerance, as everybody has their own tolerability. Medications is another thing. We can also go for over-the-counter like pain relievers, sleep aid drugs, and antidepressants, but they need to be prescribed by a doctor to help alleviate the symptoms. Then we'll talk about the emerging therapies that are coming. So exciting developments are underway in chronic fatigue syndrome treatment. There's a molecular hydrogen therapy. So a study in 2024, it actually reported that inhaling hydrogen gas improves fatigue and cognitive symptoms in chronic fatigue syndrome patients, and that possibly by reducing oxidative stress. Another thing is immunomodulatory treatments. Research indicates that immune system dysfunction plays a role in chronic fatigue syndrome, and investigational therapies aim to restore the immune balance. Then there's a digital precision medicine. We'll talk about the Biomap AI, which is a deep learning framework that's being developed to identify the biomarkers that can actually predict the treatment responses, and that can actually, you know, pave the way for personalized therapies for a lot of patients. So the DECODE-ME study, the largest genetic investigation into the chronic fatigue syndrome, it found significant genetic associations with immune and nervous system pathways. These findings, they challenge previous misconceptions and open, you know, new places for targeted treatments. And then let's talk about the lifestyle and supportive measures that we can take. So alongside medical treatments, lifestyle modification can actually support recovery. Balancing activities and rest can actually avoid symptom flare-ups. Sleep hygiene, it's very important. I've been stressing about it a lot. You need to establish a regular sleep pattern to improve rest quality. And then diets and supplements, like always, you know, consult your healthcare before starting with any possible new supplement. So I'll be talking a little about certain supplements that can be used for chronic fatigue syndrome. So some patients, they explore dietary supplements, and it has, we have data that it has actually helped patients in reducing the symptoms. A few supplements that I'll be mentioning today includes coenzyme Q10. It's a study that's it found that Q10 supplementation, it improved actually exercise tolerance and recovery time in CFS patients, that's the chronic fatigue patients. And then L-carnitine supplementation, and also has been known that it has reduced fatigue and improves the cognitive functions in CSF patients as well. N-acetylcysteine, very important. It has antioxidant properties and may help reduce the oxidative stress which is associated with the chronic fatigue syndrome. Another important supplement, magnesium. It helps in reducing muscle pain and improving the sleep quality in such fatigued patients. Then vitamin D is also very important. I mean, we all know that it is very important for the bones, but it can actually improve the fatigue levels in CFS patients as well. So again, always consult a healthcare provider before starting any supplement regimen. So this is Dr. Munir, and I'll be signing off again with another video for you guys next time. If you find it helpful, please do like, share and subscribe my channel. Thank you so much, and see you next time again. Bye.